Hey everyone, it's Matt Shu from Upright Health, and today I am answering an email that I got from Brad, who is somebody who actually used Healthy Hips 1, the hip program that we put out before the FAI fix. It's for building fundamental flexibility, mobility, and some basic levels of strength. And he says, first, I want to thank you for all of the content you have put out that has helped many people like myself get out of hip pain, so you're welcome. He purchased Healthy Hips 1 a while ago and has noticed an increase in hip health and a decrease in hip pain. He says, I love the glute activation exercises, and it was only after including those isolated strengthening movements that my hips stopped hurting as bad as they once did. And then he brings up a super good point that I want to talk about in this video. He said, I believe that stretching and glute activation was only half the battle for me. The piece of the puzzle that almost entirely eliminated my hip pain when combined with the stretching and activation exercises was trunk core stability and strengthening. And so he asked me, is this something you commonly see in your clients? Maybe I've overlooked some videos. But I wanted to ask you just to see what your thoughts are on the topic of trunk stability and see if there's something that could help more people like himself get out of hip pain. So actually, Brad, this is a fantastic question. It's something that I've touched on in previous videos when talking about FAI. I believe there was a video about a year ago I talked about anterior tilt and pelvic and posterior pelvic tilt and how the tilt of your pelvis can really drastically affect hip range of motion and comfort levels in your hips. So the short answer is yes, it's definitely something we've seen, and actually in the FAI Fix program we do go into that pretty strongly. We do talk about that because it is a big deal. So to demonstrate it really quickly, what Brad, I haven't ever even seen Brad, but I can, with 99.99% certainty, say this is what he has noticed. He has noticed that by doing stretching and strengthening things, strengthening back here and stretching things out here, he's getting less and less pain, but he's noticing that if this is really weak, he'll still get some issues in the groin and probably up front. Now, I'm saying this with 99% certainty because maybe he's a freak, maybe there's something else going on, maybe it's a slight variation. But I can say this because I can show you right now what happens when you have a weak trunk and weak lower abdominals and weak abdominals in general and just poor control of your core. So if I go into an anterior tilt, which is what would happen if I had poor trunk stability, poor core support. If I go into this anterior tilt and I go to lift my leg, I am stuck. Okay, so this is actually something that I noticed years ago when I was playing hockey. In my mid-20s, I was thinking, God, why can't I not lift my leg anymore? It must be my hockey pants. My protective equipment must be too restrictive. I'd go up, and this is as far as I could go, and I just felt like, man, I cannot get enough of my knee up to do anything. I can't go fast. I can't really dig in and sprint forward. I just can't get this knee up. It just doesn't feel right. And it would happen on both sides, so I thought for sure it had to be my pants. Now here's the thing. This is me in that anterior tilt with a lot of lordosis, my rib cage flared. If I come up like this, I already feel jamming in my adductors right here, and I feel the top of my quads sort of cramping. So again, anterior tilt up, already this is not feeling good, and then it starts to jam up in the inner thigh, which people who have been told they have FAI often experience, and hockey players for sure. So this is something that we talk about in the FAI Fix. You want to be working on ways of basically increasing your control of your pelvic position. So if I'm here, look at how far up I can come, right? I can get my knee way up above that parallel point. I can now do what I need to do. I can go deep into my stride, and it should be no problem. But that's all dependent upon pelvic position. So when Brad's talking about abdominal training, trunk core stability, those things are important. You need to be thinking about how these muscles help control your pelvis and stabilize you when you're moving. If, for example,
I can maintain a good position while standing, but then as soon as I get into sport, I dump and then start to go, I'm going to have trouble. So this is something we go into a lot with FAI Fix, the basic program, and also FAI Fix for athletes. But in general, what you're looking to do is gradually and progressively build up the lower abdominal strength and your overall control of that area without using the quads and without using the adductors, without using your hip flexors to try to compensate to maintain that position.
So Brad, yeah, really good question. It's definitely something you want to be thinking about. Brad mentioned a couple good exercises. Dead bugs are really helpful. You can do things like heel taps. You could do planks. Those are things that we do talk about. You want to make sure that you're doing them at the right level of difficulty, because if you force yourself to do too much too fast, you start to compensate, and then you're basically shooting yourself in the foot or hip or whatever you want to call it. So Brad, that's a really good question. Definitely keep up on the trunk core stability training. Make sure you keep the abdominals engaged. Constantly challenge yourself to get better and better abdominal control. It's something that I definitely feel like is super useful for people with hip issues. It's definitely something Shane feels is super useful. It's something all of us here think is very useful. You just have to train it progressively and carefully so you don't start using hip muscles to try to compensate for weak abdominals. So thanks very much for the question, Brad. Hope that helps answer your question. And we'll look into some other exercises in the future, in future videos. Anyway, hope that you remember that pain sucks. Life shouldn't.